I'd like to welcome you to this new episode of D Talk, the podcast series of the International Diabetes Federation. I'm your host, Phyllisa Deroze. In this episode, we'll be talking about the impact of diabetes complications and the links between COVID-19 and diabetes. I'm delighted to welcome our guest today, Professor João Felipe Raposo. He is currently an assistant professor of public health in the medical faculty of New University of Lisbon and has been the consultant of endocrinology at the Portuguese Diabetes Association since 2006. Professor Raposo is also the program chair for the upcoming IDF Virtual Congress 2021 this year in December. Professor Raposo, thank you so much for joining us.
It's really my pleasure to be here, and thank you so much for inviting me to be part of this series of podcasts. Thank you, Phyllisa.
You are welcome. So, I'm going to ask you some general questions about COVID-19 and diabetes, and I'm looking forward to today's wonderful discussion. To begin, I want to talk about IDF is dedicating its virtual congress to the impact of diabetes complications. Can you tell us why it's important to tackle the short and long-term health effects of diabetes?
That's the most important question on diabetes, because I think for the societies, most of the people without diabetes don't realize the importance of diabetes and the possible burden of diabetes that comes through the burden of the complications. For most people in the community, they still think about diabetes as not an important disease related to sugar in your blood, and sugar is always considered something nice and sweet. And so it's difficult for us, and it's difficult for people with diabetes, it's difficult for the healthcare professionals that work with people with diabetes to create this awareness of the diabetes complications. And really, diabetes is a serious disease because it can create complications, and those are nowadays all around the world part of the global burden of disease associated to diabetes. And when we're speaking about this, we are speaking about retinopathy, so causing blindness. We are speaking about nephropathy that can lead to chronic kidney disease, renal failure, the need of hemodialysis or renal transplant. We are speaking about neuropathy and foot ulcers and amputations. But we are speaking about some more common diseases as heart attacks and strokes. And diabetes is related with, in a huge proportion of those complications. And those are what to calling the classical chronic conditions. And nowadays we are realizing that diabetes is more implicated even with liver, with non-alcoholic fatty liver disease. That was something that was not so important or known a couple of years ago. And and as you have mentioned, Phyllisa, it's also about acute complications. And acute complications, and usually we are speaking about hypoglycemias or hyperglycemic crises, are really also quite relevant with a huge impact on the quality of life of people with diabetes and causing also a possible burden on the economical health system because it leads people to emergency rooms or to serious accidents. And so it's very important to have this focus on diabetes complications. And I think it was quite a fantastic idea of the International Diabetes Federation to have created these congresses, these meetings only on diabetes complication, and only is a short term for a huge amount of information that's possible to deal and to tackle in this congress.
Well, thank you so much for that. So much information. Like, as a person who's living with diabetes, I feel like a lot of time it's silent. Like when I hear long-term complications, I'm like, well, how much is long-term? You know,
Mm-hmm.
so
Yeah.
I'd be interested in knowing What could people do today? Like one thing that they could do today that could help kind of prevent some of those long-term complications?
Well, that's also, as it was expected, a fantastic question, because it's easy to make it, but it's my answer has to deal with two dimensions. The science dimension, while still we don't know exactly the same information about every complication, but we know that having your diabetes well controlled with normal or near normal levels of blood sugar, having your blood pressure control, have your lipids control, do regular screening of those complications really can prevent or in some cases delaying these complications. But on the other side, it's still difficult to explain and to change the behavior of many people living with diabetes, because as you mentioned, these long-term complications just mean it's something in your future. And it really depends a little bit of your personality, the way you deal with that concept of long term. Long term can mean, and it means for most people, that's something that can happen in a long time scenario. And so it's really, I, I'm not obliged to change anything today about the possibility in a long term future.
Right.
And so when we try to use that, and it's something that the healthcare professionals, we are quite biased to do that, threatening people living with diabetes about complications, saying if you don't do the right things now, you can be blind in 10 years or 15 years. And that's something that it seems logical to do this kind of threats, but it doesn't, it's proven that it's not changing or not leading to changing your behavior. You have
Yes.
that's why education of people living with diabetes, starting to discuss the motivation to be well compensated today, and try to find the reason to have your diabetes well compensated today. And of course, we know that the benefit is something that will come in the future. But if we demonstrate it's possible to live today in a better quality of life, preserving your quality of life or improving your quality of life, for certain will be more successful than just threatening with complications. And that's why, from one side, healthcare professionals, the diabetes educators, lay people working with people living with diabetes, they all should be trained in these competencies, in these skills of finding the motivation and finding the right way to lead people to having their diabetes better compensated with all the other risk factors. From the healthcare professionals, we still need to take a little bit of the what we call the glucose-centric approach, so just focusing on the glucose levels, because we know now, and we have been knowing that for many years, that the complications associated to diabetes, they are really connected to also to blood pressure, to your lipid levels, if you smoke or not smoke. And so all those factors are important to be corrected. And of course, we still need a lot of research on knowing a little bit more on the what we call the natural history of those complications. Because we all know, and people living with diabetes seldom tell me that on consultations. Well, I know some people that they don't care nothing about diabetes and they don't have any kind of complication. And me, I have my diabetes perfect, and now someone has been telling me that I have a slight degree of retinopathy or nephropathy. It seems a little bit unfair, and of course it's unfair, but life is not always fair, as we all know. But still, that reflects that we still don't have the capacity, from the scientific point of view, to know exactly why some people are more prone to complications or to specific complications.
Well, I can say this, Dr. Raposo, you are my hero, and that's just the first real question I've asked, because when you said scare tactics do not work and we need to find like the key to the motivation, I'm like, yes. Because when I was diagnosed, I got a pamphlet of scare tactics, and I was like, well,
Yeah,
why would I manage diabetes if I'm doomed to have an amputation and end up blind, right? So that
yeah.
doesn't work. And getting the
Yeah,
motivation.
but it's used all around the world, still used all around the world. I've been looking because I started to work at the Portuguese Diabetes Association some 20 years ago or something like that. And the role of this association, it was also to educate people. So when it was founded 95 years ago, the founder said it's more important for a doctor to be the educator. And the educator was to put the people with diabetes in charge with a strong focus on motivation. Because otherwise, you will not have any kind of success. We are keeping giving leaflets with information about diabetes, and people living with diabetes, they know all the information. Most of the people know, they know all about the importance of the physical activity, about healthy foods, about even your blood sugar control. But still, people have to live their own lives as expected. And for that, they have to squeeze the diabetes there without interfering with their perception of the quality of life, with their relation with the whole community, with the family, with the co-workers. And that's something that we are still not trained as healthcare providers to have that analysis. And I think that will be the only way to have more success on the control of diabetes, apart of the other things we have been mentioning, but that's fundamental.
I agree. And in talking about like exercising, I used to do a lot of 5K races and then COVID happened. So
Mhm.
my next question for you is like COVID-19 has completely changed really the world over the past 18 months.
Mhm.
And people with diabetes have been disproportionately affected by the impact and the seriousness of the virus. Can you describe what we know so far about the links between COVID-19 and diabetes? Excuse me, and diabetes? Some of the ways we can address this?
Yeah. So, uh, if we don't know so much still about the diabetes complication, we know less about the COVID and diabetes. But from the first moment, we knew about the strong relation about COVID-19 and 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 diabetes, specifically not about the risk of being infected with COVID. That's the same with all the population, but the risk of having serious conditions of COVID-19 infection. And that there are several possible explanations about that relation, because people with diabetes, specifically people with not so well compensated diabetes, they are what we call in medicine in a pro-inflammatory state. So meaning that your body is in a low degree of inflammation. And we know that that degree of inflammation is associated with less capacity to fight infections. And so it was known that relation with other infections, and during a pandemic, that was more clear for most of the people, more evident for all the people. And that was the first step to know that strong association between diabetes or diabetes not so well compensated with the serious conditions of COVID-19. But then we knew, and that's the difficult part of epidemiology, the numbers on health, because we knew that it was also about more elderly people with diabetes, and age by itself was a condition, as we have been unfortunately been knowing about the mortality associated with COVID. It's quite strongly associated with age, but also with obesity, and we know that diabetes is also associated with obesity. And so people with diabetes, usually also they don't have only diabetes, depending if you have type 1 or type 2, considering your age. And so it's diabetes by itself could be a risk factor, and is certainly a risk factor for those serious conditions of COVID, but it's also considering all the other diseases that cohabit in a person, they will lead to more serious forms of COVID. But then, as you have mentioned, Elisa, it's also about what happened with people without diabetes not getting infected, but during the pandemic, what happened to them? Because we knew all around the world that people, most of them were in lockdown situations, so people stayed at home, and that means a different pattern of physical activity, a different pattern of food habits, different access to healthcare in general, So less screening of complications, less blood results, and so we are still probably will be knowing in the near future what was real the impact of COVID-19 on people living with diabetes, not only on the infected ones, but largely on the population that was not infected, but had to change a lot in their lives, and
Right.
we are getting to know that impact, because all around the world there were reports saying that people didn't have their feet checked, so probably the number of amputations will rise. People didn't have the eye screen, and usually that's a yearly exam of your eye. So if during a year or more than a year you didn't have your eyes checked, probably a part of those people will have a more serious condition than before. So it's a huge impact, but also we are not used to live in a pandemic. Probably the best way is to learn, and I think we have learned a lot on changing also with the teleconsultations, with phone calls, with the access to technology to share information. And
Right.
I hope really that will be changing also the healthcare pattern for the future with the good things that we at least we have learned from a pandemic. Even if we all agree it was better not to have the pandemic, but since it
Okay.
happened, let's go and learn something from it.
Yeah, I agree. I've enjoyed having the telecommunication virtual conferences with my doctors. And in terms of like COVID-19 and diabetes, I know I have some friends who have diabetes and they are seeing the messages that people with diabetes are experiencing complications. And so they don't want to go outside for any reason. And then there are others that are like, well, I'm okay. And thinking about how I manage, like for people who have diabetes, should they think about how they move throughout the world with COVID, or should they move like everyone else? Like, what should a person do extra, if anything, if they have diabetes right now in the midst of COVID?
I think we have. It really depends on which country you live and the access to healthcare, or if you are planning to travel, where to you are planning to travel. I think, and we have tried to do that also during since the last 18 months. The best advice is also to have your diabetes well compensated, in good control, because that's the most important thing. Even if you get infected, not to have an increased risk of any kind of serious COVID-19 disease. But a part of that, we pushed really hard, at least in my country, in Portugal, to have people vaccinated. So we pushed a lot that at least all people with diabetes from the start would be a priority group for having the vaccination, considering that increased risk, and not and trying not to differentiate between good control and bad control, because it was like putting a label on those people with poor control, they need a vaccination and the other ones not, and it could also lead to people having a poor control just to have access to vaccination. And so we try to simplify the things and put as a general indication for people with diabetes to have vaccination. And so I think we are, depending again on which region of the world you are living and are planning to travel, but I'm hopeful that we'll be with the vaccination process with not such strings on the healthcare process in the hospitals and everything. I think we'll be having people with diabetes living as all the other people with this new infection, and we'll have to learn to live with it also, as we have been living with many other infections for the last centuries or millennium.
Okay, thank you for that.
Yeah.
Um, this year, the global diabetes community is marking the centennial discovery of insulin, like 100 years, which there'll be a special focus at the IDF Virtual Congress in December. In the 10 years that I've had diabetes, I've noticed some advancements that have taken place. So, over the 100 years, can you describe some of the latest advances that have happened to help people with diabetes manage their condition?
Sure, as you said your personal experience, that I think it's quite relevant because it's what we have been trying to do in science and with all the stakeholders involved in this process of care. But for sure, still the the, the most important event was really the insulin. I think it's still the discovery or trying to find the discovery of the possibility to use insulin. It really saved life and still saving lives. And what has been happening during those 100 years, while it's quite relevant for people living with diabetes, and you said here you have been living with diabetes for the last 10 years, and we have seen still an evolution of that. But when we try to show to people saying, okay, living with diabetes now, it's much better than it was 60 years ago. It's not so important for people who have been just diagnosed, as we have started to say. Diabetes it always causes an impact on having diabetes and say, trying to say something like that. Now it's much easier to live with diabetes than it was before. Either you have been living with diabetes and then you can measure that advance, or if you have having the impact nowadays, even if you say now you can, instead of pricking your finger, you have sensors to use it. Okay, but even for people that didn't have sensors before because they were not diagnosed with diabetes, living with the sensor is still difficult. Saying
Right.
to people with type 1 diabetes, now you have insulin pumps, but at the start, people had to inject themselves with glass syringes and large needles, and that was their life. Still, it's difficult, or it may be difficult for people living with an insulin pump because there was something that they didn't feel the need to use that. So I think the 100 years it's what we call here a round number. So it's a milestone important for diabetes. But I think we have to be um, asking more from the society, from the scientists, from the industry, that still after those 10 decades, we are still having the need to inject insulin. So it's we have technology has advanced a lot, but still we are far from automation. We are far from having easier ways to deliver insulin. We're still not tackling the right way type 2 diabetes. So I think this is quite an important moment to make this kind of balance between what has been achieved, and a lot was achieved, but still we need a lot of different stuff to increase and to offer better treatment for people living with diabetes, type 1, type 2, gestational diabetes, rare forms of diabetes. So diabetes, it's quite a huge world of uncertainty today. And I'm a doctor, and we as a scientist, and we as a world of people living or not living with diabetes, should push this movement to have better results in diabetes and not being just happy what has been achieved up to now. We have to recognize the importance of what is achieved, but still we cannot offer the cure for diabetes, which is something terrible for when I do the consultation for someone that's just been diagnosed and say, okay, I cannot offer you the cure, but we can control. And control is not something that people are aiming to when they have the diagnosis of a disease. Of course, getting the control is better than nothing. But if I say, okay, we are going to start a new treatment to achieve the cure, you'll have to do this to achieve the cure. And we, in this healthcare world, we have to achieve that.
Yes, yes, yes. Like, I could give you a round of applause. I'm telling you, just thinking about injecting insulin, like when I first started, 10 years ago, the needles were really big. Now they're
Hmm.
smaller, and I'm like, thank God for, smaller needles. But like you said, like getting to the point where you wouldn't even have to inject. That
Yeah,
would
that
be amazing.
of course. It seems logical, but still, so this increase in the development of therapies, of technology, I think still needs a lot of the input of people living with diabetes also in this process. That's something that also we try to promote at IDF and through the patient associations to include the patients in this early process of development of these things. Because really the needs of people living with diabetes and they are different. So if you get two people living with diabetes together, they'll have different needs. So first one would say that this is quite important for me, and the other one is not.
Right.
But the only way to have success on this is to do this kind of group analysis to try to find common needs, specific needs. But from the start, it's not like having a new app on diabetes, and you for sure know, I don't know, thousands of different apps for diabetes. And most of them, either they were creating for people living with diabetes, considering their own needs, and so they are not the needs for other people. Or sometimes they were created for a fantastic group of engineers, informatics, or people working in the industry and, and trying to forecast the needs of people living with diabetes, and then completely missing the relevance of what they were doing. And with that, we are wasting resources. And I think we should do this kind of working together
Yeah.
from an early start, and we should develop this new way of working.
Yeah, I agree. I think that's so important. I remember going to a diabetes conference. I shall not name any names. It was completely medical professionals, no one who was living with diabetes. And I felt really weird as a person with diabetes. Like they're talking about me, but I'm not on the stage. And when I went to IDF, it was different. Like you said, like including, like I'm in Blue Circle Voices. When I got the invitation, I was like, yes, I would love to like be a
Yeah.
part because it's so important, that collaboration, like you said.
Yeah, society now is changing. I think now it's with all those efforts, like they said about IDF, because IDF was the only congress where people with diabetes, living without diabetes, non-healthcare profession, would attend, because most of the other countries have laws, specific laws, saying that if you have a kind of medical congress, people non-healthcare professionals wouldn't be able to even go to that physical space there. They are not able to attend. But now I think there's this kind of developed world means having the people involved, sharing information, sharing the responsibility. And as you mentioned, Felicia, it's the only way to do it.
Yes, I agree. Um, the next question is over 460 million people are currently living with diabetes, and the new edition of the IDF Diabetes Atlas, which will be launched during the IDF Virtual Congress this December, is likely to show a further rise in that number. What are some of the ways that we can reduce the impact that diabetes is currently having on individuals and societies?
That's the several $1 million question. And well, again, we know the technical answer for that is saying, okay, we can try that addressing prevention, diabetes prevention. And for diabetes prevention, either we can consider type 1 diabetes, because we know that type 1 diabetes is also increasing in most of the countries, while the absolute numbers are quite low compared with the pandemic of type 2. But,
Right.
but still, we don't know exactly, or even the slightest idea, how to prevent type 1 diabetes, to be honest. And, and for that, so we don't have a specific prevention for type 1 diabetes. For type 2 prevention, it's quite a different story. We know that it's possible to prevent type 2 diabetes, or at least to delay significantly the type 2 diabetes diagnosis, if people change their way of life. if people combat obesity or overweight, being overweight. And for that, we all know that they should do more exercise, and we all know that they should do an healthy diet. And that's the two things that have been demonstrated for, I don't know, for more than 30 years now, that they really work. So that's not it's not a problem of knowledge. It's how to implement that. And two or three different approaches can be done. Either you can blame people individually, saying, okay, it's your fault. You should you should have done a healthy diet. You should have been doing more exercise. Otherwise, you will be having type 2 diabetes in a couple of years. And then with that, you are just putting the sole responsibility on the people living, having the risk to have diabetes. And that it can work for a very limited number of people. Most people would feel that as a threat, and then they would start enjoying their life, eating now because I'll have diabetes in the future, and then I will have some limitations of what I can eat. And so that approach usually doesn't work. Then you'll have a little bit more of the public health perspective. So it's either addressing general population or just addressing what we call the high risk population.
Okay.
If you want to address the general population, you really have to consider diabetes as a kind of societal change challenge. So it means that it's our responsibility as a society, as a country, as a region, as a city, as a family, as a
Right.
community of workers to have a better environment, making easier for people not not having those non-healthy behaviors. So if you have a good network of public transportation, you don't people would go with public transportation instead of having their cars.
Yes.
If children can go to schools by walking or biking, we'll do diabetes prevention, even if you're not speaking about diabetes prevention.
Mhm.
So, and as that, you are not trying to push people to individually change their behavior, but you are changing the society, and as that, preventing diabetes and preventing other non-communicable diseases. So we are preventing cardiovascular diseases. You are preventing some kinds of cancers. So it's that kind of approach that we really should push, and that's a lot of on the health policies. And so we should push politicians to be able to change their way of thinking and putting a focus on these kind of prevention measures in opposite just offering healthcare uh, uh, treatment for people already having the disease or even having already the diabetes complication. Of course, we need those treatments. We need those people well taken care, and for that, we have to be demanding this, all the new treatments, all the technology. But we also know that all those are quite expensive.
Right.
And for that, if we want to have those treatments available for people living with diabetes, we should have part of the money applied to diabetes prevention, applied to NCDs prevention. And for that, we have to have effective measures because up to now, as we have said in the beginning, we are just giving leaflets or some public campaigns about a healthy food. And even if they work, they should work in cooperations at the same time as other measurements. The taxes on sugary beverages, the taxes on non-healthy fats foods, they are important. They give a political message for the community also, but by themselves, they don't work. So that's kind of the health in all policies, the diabetes prevention in all policies that we should demand.
I I like it. I'm going to share a story with you. You know, like they tell you healthy eating. I had no real idea of what like healthy eating was, but at some point I decided that I wanted to reduce fast food.
Mhm.
And I moved to a new city, and the closest fast food restaurant was like out of the way from my house. And I realized I hadn't eaten fast food in like 8 months.
Yeah.
And I was like, wow, just because of the way the city was
Mhm.
designed,
Yeah.
it didn't make it easy to get fast food. So,
It really works. It's quite a good story. About physical activity, I also can give an example of my city here, Lisbon. I don't know if you know Lisbon, or but Lisbon, it's a very hilly town, so it's up and down all the time. So when we're speaking about having bikes in Lisbon, everyone say it's a crazy idea for having bikes in Lisbon because it's impossible to all this thing. But then the municipality here, the local government, decided to implement just pathways, the bike pathways specific for bikes all around the city. And now you can see, I don't know, thousands of people
oh, wow.
riding bikes or in the middle of going up and down. And now it's with bikes, we have even they can have a kind of electric easy bike to be more easy. But then we are starting to demonstrate it's possible to change in a natural way, as you have been saying. If
Right.
if I have an easier access to healthy food than to not so healthy food, if I have an easier access to some measures that it make me easier to walk, to bike, then I don't have to think about my risk of diabetes. It would
Exactly.
become natural to live in that kind of environment. And
Yeah.
that's the solution. Because otherwise, and that's another risk on our society, we are going to put the pre-diabetes, the people at risk of diabetes, almost as if they were sick, as if they were already have an illness. And now the scientific world is also discussing about the introduction of the drugs for diabetes. Why not using in pre-diabetes? And then it's again just putting the disease a little bit earlier, but actually we are taking out the opportunity to change our society for
Right.
that better world. And so we are all responsible to change our society. And that's, I think, one of the strongest message on diabetes prevention.
Oh, okay. And to answer your question, I have not been to Lisbon, but I know that the next IDF is scheduled to be there. So,
So you'll be much welcomed here, and I think you'll enjoy Lisbon, the city, and the healthy food also,
oh, no.
uh, and this way of living here in the south of Europe.
I've been enjoying this conversation so much. We're coming to an end, but I have one last question for you. You have a long-standing working relationship with the Portuguese Diabetes Association, the world's oldest diabetes association and a national member of IDF. Can you tell us how the association supports people with diabetes in your country?
Yeah, for sure. So, as you have mentioned, that's the oldest diabetes association in the world. So, it was founded in 1926, shortly after the introduction of insulin treatment in the world. Our history from the start, it was something. There was a Portuguese doctor, it was Dr. Roma. He was in the States at the time of the introduction of insulin. He was studying different things there, but then he understood the importance of insulin as one of the first miracle treatments in medicine. And so when he returned to Portugal, he changed his interest. He was much interested in psychiatry, but then he changed to diabetes, and he realized also, and it was quite evident, that insulin was so expensive that poor people living with diabetes wouldn't survive, wouldn't have access to insulin. So the original name of the Portuguese Diabetes Association was the Association for the Protection of Poor People Living with Diabetes. That's the original name. So, and the main goal of the association was to provide insulin for free for the poor people living with diabetes. But at that time, Dr. Roma understood that it was the insulin treatment changed the kind of health paradigm that was putting people living with the disease in charge of their treatment. And for that, he started all what we call now the patient therapeutic education of people living with diabetes. So he started at that time group lessons. He decided to have it was called the dietary kitchen. So there was a real kitchen where people have to make their choices of foods and learn how to cook in the best way. And so it was quite a different way of approaching the disease model, the acute care model. So, and that was quite relevant at that time. So it was the patient association according to the patient needs. And then during those 95 years of existence, it's quite a different model of association. It's a patient association. It creates awareness for the community. It fights for the rights of people living with diabetes. But it's also a large outpatient clinic for diabetes. And the idea of having this outpatient clinic for diabetes is to define the standard of care for people with for diabetes all around the country. So saying to all the other healthcare providers that they should do what we do here. The multidisciplinary approach, the integrated care, all these still new concepts, they have been implemented here for many different years. And so and it's our responsibility also to address the needs of people. Just an example, during COVID, we felt that people could be afraid of being lonely, for being at home. So we proactively decided to call every people in our list saying, okay, even if you don't have an appointment, but just to know that we are here, do we have specific needs? And people realized that was quite important. So because someone was caring for them in a proactive way, and as that, they felt more confident to fight the pandemic, even if without COVID-19. So providing all the educational materials, trying to fight for having the best access to technology, to the new drugs here, trying to implement research, the knowledge, as we have been mentioned, it's quite important. And so we have prizes for research, trying to work together with the universities to know more about the disease, to know more about complications, to know more about the numbers of diabetes. The Portuguese Diabetes Association with the Portuguese Diabetes Society, we published every year the numbers of diabetes in Portugal. So it's some official information about the number of people taking care, what are their results, if there are regional difference. So it's a way that every year we try to promote that discussion, at least a yearly discussion on the results on diabetes. 10 years ago, we had one of the highest rates of amputations, and we published that here. And the discussion, it was so important that the government decided to promote different care for people with diabetes, specifically considering diabetes food treatment. And the rate of amputation has been decreasing for the last 10 years. So it's important to have those things addressed in a proper way. It's just not fighting, but having the numbers, having people informed, information, health literacy, people educated and responsible citizens. It's also something that we try to fight here.
Oh, wow. I am so impressed. And like knowing that the amount of amputations have gone down is absolutely amazing and commendable. Thank you so much for this conversation, Dr. Raposo. Um, if I was not interested in the idea of virtual Congress, which I already am, I definitely would be after this conversation. So again, we've heard a lot of insightful and useful, valuable information from you today. I'm sure our listeners across the world will feel the same way. Before we close, I'd like to ask you, where can our listeners find you on social media if they have any follow-up questions?
Yeah, please. Well, Phyllisa, first of all, thank you for your nice words, kind words, and it was a great pleasure for me to have this talk with you. And people can find me here through the APDP, so either in the web page of APDP or in the Facebook, all the social media, you'll find the Portuguese Diabetes Association quite easily, and I'll be glad to answer all your questions or addressing any kind of suggestions you have. Thank you.
Thank you. That's all for this episode. Thanks for listening, and make sure you join us soon for a brand new episode of D-Talk, Conversations in Diabetes, brought to you by the International Diabetes Federation. Thank you.